Healthy every day, helping make a difference for life.
With fall sports now underway, we want to talk to parents about the signs and symptoms of concussions. So we are standing here with Dr. Ronshagen, who is a pediatric sports medicine physician with Children's Hospital and Medical Center. Talk to us about what a concussion even is.
So a concussion is a type of brain injury. We talk about it as a mild traumatic brain injury, and usually it is caused by either a head-to-head contact or a whiplash type injury. And while we call it a mild traumatic brain injury, some of the symptoms can be quite severe.
What are the signs and symptoms that a parent should be looking for?
So the symptoms can be very broad. A lot of different things can show up with a concussion. But any athlete who gets knocked unconscious briefly, now a longer loss of consciousness is probably a different scenario, but a short loss of consciousness could be a sign of concussion. Or an athlete who stands up from after being hit and looks confused or a little bit dazed or glazed over. Also, some of these athletes can have a pretty significant headache, even dizziness or nausea and vomiting.
What do we do if we suspect a child does have a concussion? What's the treatment?
So the main treatment for concussion, as long as that is all it is that we just wait and allow it to heal. Now, if there are any signs or symptoms that it could possibly be something more severe, the athlete seizes on the field, they are unconscious for longer than a few seconds, they have tenderness on their spine, or they have weakness in any of their limbs, or they just keep vomiting, those athletes actually need to go to the emergency department. But thankfully, most athletes who get concussed don't have quite that severe symptoms and can just see their primary care doctor.
When do they come see you?
So I don't need to see every single patient. Primary care doctors can take care of a lot of these, but if you're concerned about multiple concussions, if you have a patient who's had very severe symptoms, or if you're not really sure if it's a concussion or not, those are all athletes that I would like to see in my clinic.
Awesome. Thank you so much for joining us today, and thank you for joining us. Until next time, keeping you healthy every day, I'm Kaylee Tripp.
Healthy every day, helping make a difference for life.